My name is Richard Devine. I'm the Support Network Coordinator for the Spinal Injuries Association in the North East. I sustained a C5-6 spinal cord injury in 2012. I'm out there every day speaking to different people, and their number one concern is whether or not they're going to receive the correct bowel care when they're in a medical setting. Unfortunately, I've actually met a lot of people who've been refused bowel care in a medical setting and been left for days unable to go to the bathroom.
I'm Danny Chinisco-Watts. I got my spinal cord injury in 2017 while playing rugby. I am a T10 level. I'm a complete injury with Asia B. So I was admitted into hospital because I had a spinal cord stimulator fitted, and I was about 4 days in and I was thinking, I do really need a toilet now, and my mobility wasn't great. I asked a nurse at the start of her shift, and then it was coming. I didn't want to do it at visiting times because the magic blue curtains, they aren't walls. Everyone can hear things, and I was starting to get a little bit anxious to the point of I didn't want to mess the bed. Like, no one wants to do that. That's inhumane to make someone do that. Only a nurse can do manual evacuation. And she came in, she put the stuff on the bed, and she kind of told me to get into position, and she's really abrupt. I'm now pantless, trouserless, in the curled up position, ready for manual evacuation. She opens the curtain to ask another HCA to pass her something. And in that point, the dignity that left me was insane. Like, I shouted at her, shut the curtain, and she left me all day and seemed aggravated that she had to do manual evacuation on me. I just felt awful. I didn't feel like a human at that point. I didn't. Just literally felt, I think, an animal. I just felt like an animal.
My name is Amy Moss. I'm a mum of 2 from Bristol. I was diagnosed with cauda equina in February 2020. I stayed in Southmead for 2 and a bit weeks, was discharged home periodically. When I was discharged home, I was discharged with an indwelling catheter. Very little about how to actually manage my bowels at that time, and that was one of the most difficult things about being home. Not the fact that I was in a wheelchair, Zimmer frame or whatever, it was actually the fact that I was pretty much incontinent from that respect, and they had managed it with laxatives to make sure that I wasn't, constipated, but that had an effect that was pretty horrendous to go home to.
When it comes to bowel management, everybody's needs are very different. At SAA, we're able to provide our members with an essential care plan so that medical professionals are able to understand what that person needs. We're asking healthcare professionals to challenge their trust's bowel care policy. We can work with you to help your trust improve its bowel care policy. Ask yourself, is your policy good enough?